going to be speaking today on the pandemic that have and continues to impact the world. When this initially surfaced, it proved itself to be deadly, contagious, and difficult to control. In addition, during the pandemic, we have all seen how the virus disproportionately impacts communities of color. Long-standing systemic health and social inequities have put many people from racial and ethnic minority groups at increased risk of getting sick from the virus, which is unacceptable. Since then, many health systems made a commitment to close the gap in healthcare disparities, and that has never been stronger. Many health systems have taken action by establishing clinics that provides a safe environment for all to get the necessary and available treatments as well as preventative measures. Despite all of the aforementioned, many, because of history, does not trust that their best interest is in the heart and minds of those in authority. Hence, many continue to reject what has proven to be highly effective at preventing severe disease and even death. As of December 20th, 2021, a new variant had been detected in most states and territories and continues to be the dominant variant which compared to earlier ones. This one spreads more easily and is more contagious. Those infected with this new variant may have symptoms ranging from mild to severe symptoms. And these symptoms can surface within 2 to 14 days after exposure. Many have asked, why do we have so many variants? And how does a variant work? If you think about a virus like a tree growing and branching out, each branch on the tree is slightly different than the others. By comparing the branches, scientists can label them according to the differences. These small differences or variants have been studied and identified since the beginning of the pandemic. As the virus spreads, it has new opportunities to change and may become more difficult to stop. These changes can be monitored by comparing the differences in its physical traits. Hence why we've put out preventative measures why many should take. These include wearing a mask, hand washing, and other treatments that many do not like to talk about, but we can discuss later. Let's talk about how we wear a mask. This is your typical surgical mask. When a mask is worn, it goes over your ears, but you do not wear it below your mouth. The reason being, the virus enters through your nose, and that's why many people, when they test through your ears, because that's where it stays the longest. So the mask must be over the bridge of your nose, and you must pinch it, providing a full seal over your face and at the sides of your face. If your mask is open wide, you're not protecting yourself. So we encourage you to use this string, make a twist, and tighten it over your ears like this, allowing it to seal. The next mask that many wear is an N95. These particular N95, which are the harder ones, they have some that are universal, that anyone can wear. But for most medical staff, they have to be measured because they come in different sizes. And if it's not fitted appropriately on you, it doesn't serve its purpose. It has 2 strings that both must go over your head. I won't put it on mine because I want to mess my pretty hair. The lower one goes to the back of your neck, and the top goes on top of your head. So across from your ear to ear, making a full seal. The next one is called a KN95 or even an N95. And these are the ones that are not coming out. They're in different colors. They come in white, blue, different colors. It has a metal that tells you which pieces to go over the bridge of your nose. And then you seal it again over your ears. A cloth mask, although initially was encouraged, has proven to not be so protective. So we encourage you to wear a surgical mask if you're able to get one. That is available at your local pharmacy. If you're in the United States, It's being given out at pharmacies for those that are here, along with testing kits. Some signs and symptoms that you may experience. You may experience fever, chills, a cough, headache, muscle and body ache. More severe symptoms that these can lead to include, but not limited to, shortness of breath, persistent pain or pressure in your chest, new confusion, inability to wake or stay awake, diarrhea, GI bleeding. You may become pale, gray, or blue-colored skin, lips, or nail beds, depending on your skin tone. And this is a sign of decreased blood perfusion to your body. And these are very critical. Any questions that I did not address in my summary, I'm going to ask that you please feel free to join us in the Zoom room where we can further discuss those. In addition, I'm going to ask if there's any particular topic that you'd like to see or hear discussed in future sessions, that you type that in the chat for me as well. Thank you.